So welcome to Urogynecology and Pelvic Healthcare. So in this we discuss about urinary, fecal and very little about sexual topics. So we are lucky and happy to have with us Dr. Poonam Mishra ma'am, a cosmetic gynae and sexual health expert. वैसे मैम को आगे नाम ही काफ़ी है, we don't need much to describe about ma'am. Thank you ma'am for coming here and giving us the opportunity to discuss with the sexual dysfunction. And today we'll discuss in detail about female orgasmic dysfunction.
Thank you, dear Mohini. And yes, this was a very important topic, and I'm happy that you have chosen this as your today's topic for this program. So, as you just raised the point, orgasmic disorders. First of all, what is orgasm? Orgasm is Hindi में जिसे कहते हैं चरम सुख. So this is the pleasure which a person attains, a male or a female attains at the climax, the climax of a sexual encounter. So the fact is that males always culminate with this orgasmic pleasure. But for females, most of the times what happens, females are supportive ones. They are just giving the, you can say that they are just supporting their partner, and many times they don't experience that pleasure.
They fake it.
Yeah. And yeah, fake orgasms are another point, another thing, like another topic. But the fact is they fake that orgasm just to make their partner feel that he was doing everything right, and he should think that yes, his female is satisfied. So this is something she's doing just to protect and to save her relationship, because the male may go into the depression. Many times that happens. Males think that they are not doing things properly and their partner or his partner is not satisfied and she hasn't reached the orgasm. But this is the physiology of a female and physiology of a male is entirely different. There is the sexual cycle also that is absolutely different. So for male and female, so many factors are there. So that is why the orgasm is something which has to be there in a sexual encounter. If a male is experiencing that pleasure, the female should also have that kind of satisfaction.
That's
but this is the irony.
We have chosen the topic today.
Yeah.
So yes, ma'am, that's why we took the topic and this and more of this, ma'am. Today's topics like when in the OPD as being I think it's related to urogyne also, because many sexual urinary goes side by side, and this is obviously the least talk about by the doctor and the patient.
And the patient even, yeah.
Both expert. So we'll starting, ma'am. I want to our viewers, to our students, to first tell the model. I think there's an MG model, the excitement and that. So we'll discuss today specifically about orgasm, but I just want you to enumerate the phases.
So the typical, the old Marks and Johnson's that cycle, the linear phase model is there. So there is arousal, excitement, and then there is there are phases, different phases. So excitation ho gaya, uske baad the next is there is erection, and then there is penetration, and then there is the orgasm. Resolution in cases of restitution. And in females, there is at the place of erection there is lubrication, and then penetration, and then orgasm and resolution. The same phases, the same linear phases are there.
Ma'am, I want to know from your point of view in your practice, with a different type of sexual dysfunction, what amount does orgasm constitute? How many % the female come with the orgasm as a problem?
See, orgasm as a problem, I think minimum number of females are reporting. So it is underreported always. You can never say that this percentage is there as an orgasmic disorder our patients are presenting. So the fact is it is underrated, underreported. So we can't say, but yes, orgasmic disorders are the maximum number of desire. The most common is the desire problem, the desire disorders, and the second number is orgasmic disorders. Because many females are not getting this orgasm just because of the lack of the problems desire from the partner side. Because orgasm is something mutual. If the partner...
Very true. So what ma'am I think want to summarize that it's a female who's having the problem, but its treatment its involvement is both.
Exactly.
The cause is always both. It's
Yes.
not only the female. That I think is the most important.
That is the most important thing, and the partner has to be trained about that. The partner has to be interrogated for the problem the female is suffering from.
Okay, so a history in sexual history is incomplete without
Yes.
taking the history or talking to the male partner.
Exactly.
Any partner
So in sexual health, all the time, if one partner is having some kind of problem, you have to inquire from the second partner also. And many times separately, first one and then the second one, and then combined interrogation is done. Yeah.
So ma'am, we'll go with the orgasm problem much detail. I think there are types of orgasm which I would like to describe later. And even once, like is it a problem like if some female having कि पहले था अब नहीं है, like 1 to 2 problems should they taken into, or is there any sexual problems or having any duration कि इतने time तक है, then they should labeled as a and they should seek help.
Exactly. So any problem related to sexual health is considered as a problem disorder only after the problem is remaining for 6 months or more. Less than that has never been designated as a disorder. So she may be having some kind of problem, and that could be a transient one that could be treated by some kind of treatment or counseling. But if that problem is remaining for 6 months or longer, then only it is designated as a disorder. So the orgasmic disorders may be of many types, but before that, let me tell you about the orgasmic, how many types of orgasms are there. So the fact is that it has been divided into 2 parts, the clitoral one anatomically, the clitoral orgasms and the vaginal orgasms. 2 are there. It has been found that yes, clitoral stimulation, clitoris is a very erogenous structure in a female.
So many nerve endings.
So many nerve endings. It has got around 8,000 nerve endings, and while the male penis is having only around 4,000, 3 to 4,000. So females are more orgasmic. The God has made them more orgasmic. The God has provided more number of nerves to a female, yet she doesn't know about her potency and her the strength. And she is not acquiring that kind of pleasure. So the clitoral orgasms, because of the clitoral stimulation, if a female is attaining that pleasure, getting that pleasure. And the second is vaginal. So vaginal stimulations, because of arousal, she is wet and she is now, the partner is penetrating and she is getting that kind of, the intercourse, the rubbing and stimulation because of that intercourse. And then finally she culminates into that orgasmic pleasure. If that is there, then this is vaginal. But there are multiple school of thoughts, and they are saying that another one is saying that all the orgasms are clitoral one. Okay. Just because that very late we got to know the clitoral structure. The clitoris is not only that projecting knob up just above the urethra. That is not the clitoris. Clitoris has got a huge structure. It is the prepuce which is covering and then everything, and with that there are 2 crurae, 2 long crurae and 2 bulbs. Initially it was not thought that these are the part of clitoris. Now it has been proven, and I think in 2009 only the complete structure of clitoris was out in the anatomy books. So clitoris has got 2 crurae and 2 bulbs. So those 2 bulbs are residing just beside on the lateral aspect of the entrance of introitus ke just piche are 2 bulbs. So on lateral side, and they are just constricting the vaginal canal, and they are 2 bulbs, and those 2 crurae are also surrounding the introitus. So the lower 1/3 of vagina is more sensuous, has got another type of anatomical development that is squamous, and upper 2/3 is columnar, So the outer 1/3 has got the sensory supply also, different sensory supply. Outer 1/3 is supported by these 2 bulbs and crurae. So the outer 1/3 of vagina is very sensuous, very erogenous, and that sensations are coming from the clitoral appendages. And so finally it was
So both combined.
yeah, it was thought to be the clitoral orgasm only. Whatever happens inside the vagina is also because of clitoral stimulation. Another thing is that the place of clitoris is, you think of a mirror, and the front of the mirror is clitoris, which is projecting outside, and the back of the mirror is just the G-spot. Behind that, the pubic symphysis is there, and pubic symphysis ke just niche, below that, 2.5 centimeters from the interior wall of introitus, the introital opening, and in the interior wall of vagina, around 2.5 centimeters is the G-spot. So G-spot could be the backside of the mirror, that representing the front side is clitoris. So that stimulation is also, yeah. So there is a school of thought that which is saying that all the orgasms are clitoral ones.
But which patient comes with some may not have clitoral orgasm, some patient come they don't have vaginal.
Actually, maximum, or I can say all the patients are coming with complaints of that they are not having vaginal orgasms. Clitoral orgasms, because many females masturbate and they just attain that orgasms, and they are supporting their partners in the sexual encounters. Only the male partner is attaining that, enjoying. The female also enjoys. See, the sexual encounters are not only to attain the orgasm. It is the cuddling, it is the coziness, it is the intimacy. Yeah, the female and male, they want the companionship. Yes. At that time, the very intimate companion. Yeah, that intimate companionship is actually very sensuous, and that gives the pleasure. So if with that a female attains the orgasm also, if she gets the orgasmic pleasure also, that is going to add on. And I have always been quoting that many times females are denying for sexual activity. Males are saying that my partner always says, "Mere sar mein dard ho raha, I'm having headache now, I'm tired," and this and that. This is the reason is that all the time she is supporting and she is not getting any pleasure. Finally, the final pleasure, the final, the climax.
They wait for
she's not attaining that climax. Then how many times she's going to support? So there would be the time will come that she'll say, "No, today, aaj mera man nahi hai," sort of. But if in every encounter she is attaining that climax,
so this one,
and she's not going to deny
no.
Say
so
no.
It's like, I think I'm getting the inference, like if a patient is coming with loss of libido also, but that this may be again the cause. She may not, that's why
she's not happy in that relationship.
So you treat this and you get, so all are interlinked and everything is
yes.
So we'll go for more, ma'am, detail for like education, because I think in residency we don't have anything detail about. In a book we get a paragraph or a page and something corner or
exactly. Yes.
So ma'am, I think again two types, and by the time again it is divided into primary and secondary. So
the reason is that many females, they have not masturbated ever, so they have never attained that climax. They have never known about orgasm. That could be the reason. Maybe that strict upbringing, a closed family atmosphere, combined family. She's not getting a private space to explore her body. And the other fact is that maybe she's having some kind of problem inside her. So she has never known about the orgasm. That is primary, the primary orgasmic dysfunction. And the secondary one, that she was getting that pleasure by herself, by stimulating her clitoris or vagina or kind of masturbatory techniques, or with her previous partner. She was happy, she was having that climax, and now in her second relationship, she is not able to reach the climax or attain the sexual pleasure, the orgasmic pleasure. Now this is known as secondary orgasmic disorders.
So now in this, ma'am, as you said that with one partner she was attaining, even if the partner is same, we have seen that initially, like when the patients say that initially after marriage I used to have it, now I'm not having it.
Yes.
So that what may be the reason? Again, the relationship.
The question itself is giving the answer. That initially they were exploring each other, they were doing things properly, they were just were inquisitive about the sexuality of each other, and later things become, they become used to, and they are tired. If the husband is coming from the office and the whole day he was working, now he's tired and he wants a pleasure. He just wants that sexual pleasure. So he's not going to give the proper time, because females are different. Females in their sexual response cycle, they take time. It is just like the iron, istiri. कहते हैं ना, istri is just like istri. She takes time to heat up, and once she has been aroused, now she's ready for everything. Sexual pleasure is there, and now if everything is done properly, then she is going to attain that climax many times. She is having multiple orgasms. So this is something a female is blessed with. But the fact is that the other partner has to take the responsibility to
give the time sufficient.
To give the sufficient time and to make her reach that point. So I don't think females, if they are ready to discuss about that, minimum number of females are there who are having this kind of
problem,
this kind of pleasure in their life, just because things change with time. Things,
clarity,
responsibilities and all, and sex becomes a regular routine work for the husband, and even
moment, especially it becomes a work.
And there is a joke regarding that, कि फीमेल ने कहा कि मैंने ये भी कर लिया, मैंने सारा घर साफ कर दिया और सब कुछ कर लिया, बच्चे को नहला धुला दिया, अपना सारा काम कर लिया, खाना बना लिया, खिला लिया, बर्तन धुल लिए, अब तुमको भी कुछ करना है तो कर लो, वरना मैं जाऊं क्या नहाने धोने. That means कि
that is also work to be done.
Yeah, this type of like जैसे घर का काम निपटाया जा रहा है ना, तो she is doing like that कि भैया तुम्हें भी कुछ करना है तो कर लो, वरना मैं जाऊं, नहाऊं धोऊं और सोऊं. So नहाऊं धोऊं means ये भी एक गंदा काम है, इसको भी निपटा लो, and then I am going to take a bath. So this is, the atmosphere should be the cozy one. Things should be very pleasant in every sense. That kind of things just after marriage or just in the initial phases of their relationship, it is there. But after that, one has to do some efforts to just get things back to normal. Yeah.
Now again, there is another set of patient. Initially, they used to have now. Again, they specifically complain. Means I know, ma'am, very few patients come up with this problem. When the very few who come up, they are very specific in what they want and what their problems are. So I just want to describe a case scenario that they come, that initially the intensity was good. She is achieving it, but the intensity is not as good as well. I hope I'm better communicating. I'm getting it.
I understand. See, here again, some problem is there. One thing is, now they are used to the husband or the partner or the female herself is not giving proper time to herself and to the partner, and the partner is not giving proper time to her. One thing is this, for foreplay. Foreplay is
something very important.
Yeah, very important. So that one has
many of the, and in the history you should ask this. This is something.
Is there something?
Foreplay
जैसी चीज आप लोगों के बीच में है कि नहीं? Is it there?
An important part in history to be taken.
How much time your partner gives to you for foreplay, or what? Like, have you ever conveyed your partner
that you want this, or what you like in that from?
Exactly. What kind of touch you like? What kind of cuddling you like, and what is that which is stimulating you, giving you the excitement, and you are ready for. You think that now you would be able to reach the climax. So this kind of things should be conveyed to each other. And in our scenario only, we cannot say that Indian scenario. In our upbringing, we have been brought up in a way that we don't discuss about sexuality and sexual things. In family also, combined families where bhabis are there and nanad bhabhi ka rishta, and they just talk about things, and few friends also, so they know the exciting things are there. They discuss about, like, marriage has to happen in a few months, and now things are being discussed, but nothing like teaching something, sexuality
is not there.
education.
They discuss a lot, they watch a lot. That is also one drawback. They watch, expectations are already pre-decided.
Yes, everything
But
is.
education is not there.
And many couples are there who were thinking of their sexual encounters and the pleasures they are going to attain out of it. But actually, the real structure of a female, the anatomy of a female, and other things, and about the male also. Female doesn't know about his physiology, the way he thinks, and other things. That is why I always advocate the premarital sexuality education. Premarital sexual wedding shoots are there. Premarital wedding shoots are there, and male and
Proposed by
female
Dr. Poonam. Actually, this should be there in the.
Yeah, it should be there, and the family members, they should send the two would-be couples, husband and wife, they should reach the gynecologist or their sexual health experts, and
for this.
they should, okay, if they are well versed with each and every steps and each and every structure of a male and a female, that's nice. But see, IT professionals, my patient, the recent patient, the couple were IT professionals. They were knowing each and everything about, like, they were highly educated, and the husband said that yes, we are doing after marriage, but I think some problem is there. Whatever I am doing is not correct. And the female is saying that, ma'am, I think I'm not able to understand, but he's not able to penetrate. He says, I'm just reaching the climax also, but I think I'm not doing it properly. When I examined, I found her introitus was a pinpoint. Introitus was very, minimal aperture was there. So where he was doing? He was doing between the thighs of a female. And she was not able to communicate that you are not penetrating completely. So what kind of things? They were IT professionals, So the fact is that then I just made a diagram. I just told him, we have got models also with us.
Yes, obviously.
So I asked him that, do you think that you are going, you are going inside? He said, no, ma'am. We just cuddle each other and lights are not there. Everything is off. And I reach the climax. But have you ever thought about the female part? Whether she is, if he would have thought about the fact that the partner should also get the pleasure, he would have explored at least where he has to penetrate, where he has to touch, where he has to do some tingling or something, and then he could have known that yes, my female is not having any aperture or some vagina or some introitus, so some problem is there, and they would have come to me earlier also. So that is something. The sexuality education is the need of the society these days, and that should be there. There are premarital, pre-wedding shoots and pre-wedding sexuality education. Both should go. Yeah, it should be combined. Yeah.
Now, ma'am, when the patient, we have ruled.
How you are lucky enough to get a patient who is asking you, who is asking about the orgasmic pleasure, and she is not able to get that. If she is complaining of you, I would say that you are lucky enough if you are getting such patients. Many times I'm also surprised that few patients, out of the way, they just spoke up.
Yes,
that
and we get that one. Yeah. Very few come up, but when they come up, it's very genuine and very specific.
Very specific.
And it's like literally they want help. Now they're like, okay.
So she told ki, Mom, I'm not getting any pleasure. My husband is always getting that, reaching that climax and getting all the pleasure. But I want that, but I don't. कुछ कहती हैं कि मेरे साथ कुछ होता ही नहीं. I'm always dry. कुछ कहते हैं some fluid is released, and
I think anatomically we go more educational in this way. So they complain that because of laxity, they feel that that's why I'm not getting. Yeah, and the husband also complains the same, and that's when. So what? Now we'll get the next step in this. I want you to tell our viewers about the treatment, how to approach. Now the history is taken. We got basic what are the points in the both couple and everything. Now when everything that point is sorted, now what to tell the patient to specific, because patient come with, as you said, that lubrication is not there. She feels loose. The husband complain is loose. So what modality, what treatment, what anatomical, what drugs, any therapies, what we can
Exactly.
offer?
So this is the era of cosmetic gynecology. So we as cosmetic gynecologists have got a number of, our armamentarium. Yeah, armamentarium is full of many energy-based devices and many regenerative medicine techniques, which are actually rejuvenating the vagina, tightening the vagina, and giving treating that laxity and making the whole vagina more erogenous. We are sensitizing the clitoris also, but first you have to reach the diagnosis. You have to come up with the diagnosis.
And you have
What
to
is the
rule out
problem?
and counsel about counseling is history
Counseling
taking,
is the
then
main, yeah.
history taking and then counseling, and then you go for all these measures.
So proper history taking and then examination of the patient. Patient is saying that she is loose and you are examining, you are finding that yes, everything is fine. Nothing is there. Many patients after a childbirth, vaginal birth, they there is mental occupancy.
Yes.
They presume that
it
now
is-
they are lax. The husband is not giving any sort of complaint. Many times the husband is all the time satisfied. Many times it is all in the mind of a female only, that now my vagina is lax
how
and my
to give
husband,
the
I'm
treatment
going
and
to
what to
lose
tell.
my husband, I'm going to
Yes, that fear, insecurity.
fear.
Do something.
Yeah.
And we see. So what we can, when patients say that they are not discharging, lubricating, they are feeling lax, both the condition. They are saying it is lax and it is not lax. So how to approach it further?
Yeah, so there, if you feel tolerance is something like if a person is alcoholic, so 1 peg, 2 peg, 3 pegs, it increases. So some kind of tolerance is always there in our body. So if a person is doing something regularly, daily, so there is the tolerance develops and the threshold also goes high. So that kind
is
of,
one
yes,
thing, okay.
counseling is there. The husband should be told that now she needs more and more stimulation, more and more time, and give more time for the foreplay. And responsibilities have increased, and she's now bound with many other things. So making everything like the free mind, once she is in her bedroom with her partner, with her husband, now she should be free of all kind of anxieties, tensions and responsibilities, free of everything, then only. So this kind of counseling, so couple therapy, this is known as couple therapy. Both the partners should be sit together, and they have to be asked about their problems separately also, combined also, and then you have to tell many things. So many type of sexual therapies are there in sexual health, that is sensate, focus, couple therapies. Many type of couple therapies are there. So models are there with which you can interrogate your patient and
also
then
get their information, what they perceive at is that.
Yeah, and then you have to come up with some kind of assumptions, like what kind of problem they are facing, and then you are going to tell them that yes, they have step by step, they have to move into their sexual relationships ahead and get everything back to normal. That kind. Drugs are there. Many supplements are there because multiple vitamins, multiple minerals, and the lack of all these, whatever is
That
causing
also
the problems is causing so methylcobalamin, so vitamin B12, vitamin D deficiency, coenzyme Q10, all this kind of supplements are there, and many drugs are also there. Buspirone and few more drugs. They
just support, but main is this, that 10% only to help. Just
exactly.
For and I think more of that, it's even like patients sometimes need something. कि चलो ये सब तो कर लेंगे पर कुछ तो दो हमें.
Exactly.
They are not understanding that it's not about the drug you are taking, it's about all these things.
Just for the placebo effect even.
Yes.
You have to
give something to
some treatment. So give some kind of additive therapy. And our cosmetic gynae procedures are wonderful for the rejuvenational processes we do is I do PRP in many patients. I just find that yes, the whole vagina is
orgasmic disorder.
For orgasmic disorders also.
PRP.
Yes.
At what site?
PRP. PRP we prepare, and then we just examine the patient. The patient herself is telling that yes, this point of mine is very sensitive. So the whole anterior vagina should be explored with your 2 fingers, and in the middle, if she is saying that yes, this is my very sensitive part, so that could be her G spot. But I am from that school of thought that the whole vagina is very erogenous. Not only a single
So you give it
point.
a circumferentially
Yeah, so
without a-
circumferentially. I put a cuscos inside, and the 2 lateral walls which are popping in, I just inject PRP in all. Regular intervals. At regular intervals, I inject, and then I just rotate my cuscos and then anterior and posterior. So you can just make multiple parts of the vagina popping inside, and then you are injecting your PRP. It is a very simple procedure, and you are rejuvenating the whole vagina if you are not having the bigger devices with you, the expensive
And how
devices
much
with you.
treatment duration, like next therapy?
That depends upon
what
the
patient responds.
what kind of
But
patient has come
minimum,
to you.
How much, or only one treatment will
Sometimes that single installation of PRP has
do wonders.
done very miracles, and she has never come back. But yes, the patient told that yes, the things are very good. Now I feel that I am having oral sensations. So when should I come again to you for the top up? So we always tell that this is the regenerative procedures. This is the rejuvenation. You have to come back to us. And this is just like a female is visiting to some parlor, getting her facial done. And yes, and after that, if she feels that she is looking dull, she has to report to the beautician again or the cosmetologist again. In the same way, if the female is having some kind of dryness or some kind of problem inside the vagina, she has to report to the cosmetic gynecologist, and she'll do some procedures and she would be normal. Otherwise, see, the fact is that many females think that they are aging. Now they are growing up. They were an adolescent once, and then now she's a lady, she has given birth, now everything is nice, sensations are gone, vagina is lax. That has to happen. हमारी माँ मम्मी और दादी के साथ भी हुआ, हमारे साथ भी हो रहा है. We are also aging, and now our marital discordance has to happen. ये तो होता ही है family में. Many times husband का interest खत्म हो जाता है, and he would be searching for something else. Maybe it is there in their mind also that this has to happen, and we have to live with that. So here we are giving the message that no, this is not like that. If you are a lady of 50 years and you are looking like 30, and if you are getting that comments from others that you don't look like a female of 50, that kicks you, that gives a kick to you. So the same thing should happen with your internal beauty also.
Very true, ma'am. Very nice.
So if you think that I was getting that kind of excitement and kicks once I was in my 30s, and now I'm in 50s, and now I'm getting all these rejuvenational procedures done over me, and I'm getting that sort of sensations again which I used to have when I was in my 30s. So that has to be done over her. And there should not be some question that is this going to last lifelong? How long it is going to last?
Very true.
It is. We are rejuvenating you. So
efforts are continuous.
Yes,
There has to be
efforts.
taken. Both.
So that is known as aging gracefully. Aging gracefully. So if problems are there because of aging, then you have to get it done. If there are birth trauma or some kind of other problems, some diseases, like those who are diabetics, those who are on some kind of medications, the peripheral neuropathies, they appear earlier. So there you have to supplement with the neurotonics. Okay. So that kind of treatment, the additive treatment is also here. Again, the treatment is here. So we give in our cosmetic gynecology, there is Charles Runnell has given the O-shot, the orgasmic shot therapy. So with the preparation of PRP from patients, her own blood, you are making PRP, and now the PRP is ready, and you are rejuvenating her clitoris also. So in the base of the clitoris, you are injecting this PRP, and inside the vagina also. So this is known as orgasmic shot. So that kind of treatment is also given, and yes, females are getting good results. And we have got multiple energy-based devices like lasers. Few are having radio frequency. Another one is high-intensity focused ultrasound, HIFU treatment. So all these are actually transmitting the energy, the thermal energy, which is just being transmitted through the epithelium, and they are doing some changes inside the epithelium. The histology is changing, newer vessels are formed. The collagen, actually the collagen is the basic material.
The basic
Collagen is the basic material that gives the strength to the skin, the elasticity to the skin.
It's responsible for prolapse, incontinence,
Everything,
laxating,
yes,
sexual
and for
problems.
aging also. So the
Everything is
a neonate is having a different type of collagen,
Very true.
and an adult is different, and the aging person different, and an old person, the quality, the helical structure is there in a collagen. So the coiling, as soon as the cross-linking, coiling, these all just
Unwinding is there.
decide that yes, what kind of collagen a person is having, and that is genetically decided also. Few females are
some case scenario, ma'am. Just like we started with vaginal laxity. Now a patient comes of a 35-year-old female. She is having urgency, stress urinary incontinence, grade 2 cystocele, and with the grade 3 rectocele. And she having the main, this is all an examination, and when we ask the leading, the main complaint she comes with is the vaginal laxity and the loss of orgasm. The orgasm she's not having. So in this, I think we go for the surgical management for the cystocele and rectocele.
Yes.
With this, how you proceed for the laxity? Because I think we can't very short. Means I think that we need even to tell them that hymenoplasty is different, what they expected. They'll lax totally because of rectocele also something coming out, and the genital hiatus is more. So we should lessen the genital hiatus, or in this what we can, if the repair is done, then how we can give her the orgasm.
See, if you are doing some surgery, then vaginoplasty can be done simultaneously. So you are reducing her rectocele, and perineoplasty you are doing. So there you are doing the vaginoplasty.
Yes,
surgical repair is the best
done.
repair.
But again, she's not having that orgasm. What I'm trying to say, patient comes with a complaint, but even they come, but they are not able to express this properly. That what problem is that? Now, when we come with urgency, SUI, cystocele, rectocele, we obviously tell that this need to be done. You're having, like she's having constipation and other problems also. You need this thing.
Exactly.
And with this vaginoplasty, this will get to the normal size is okay. But when again now she says, my main problem is now I'm telling her she's not able to communicate. She feels that because of this, it is the problem, but now she's have a problem with orgasm.
See, so here it is one thing is, I would like to remind here that males, if they say that they are having erectile dysfunctions, they are having some problems with their erections, the thing which is clicking is that he may be having some kind of cardiovascular disorder also.
Yes.
His heart is going to suffer, and the manifestation is in the form of loss of erection. So the same is happening with the female also. If she is saying that initially she was orgasmic, and now she is she is taking more time to reach the climax, or she is not reaching the climax at all, that clearly indicates that there is something happening inside her vessels also. She is having some kind of vasculopathy. She is having neuropathy also. So you have to investigate her properly. That yes, it is the start of some kind of, the deep-seated pathology inside her. So she needs the additive treatment in the form of, just to treat that peripheral neuropathy. So neurotropics are to be given, and I told that this regenerative procedures, stem cells or PRP, and all kind of multivitamins, and these all are going to help her.
As you
a
said,
coenzyme Q10 in the 300 milligram per day. That dose is very helpful for the collagen reformation inside her body.
So as you said, ma'am, anxiety will also. So can we give a role of anti-anxiety drugs?
Exactly. Yes, the psychotherapy itself has got a very. You have to take the help of your psychologist friend or psychiatrist friend for the counseling purposes. He would be the better person, or if you are having that kind of skill, then you should go ahead and you have to give her proper counseling and then reach the diagnosis. The crux is this only, and then you are going to treat her.
So again, any role of, as we say, mota mota broadly, like loss of libido is because she's very anxious on this thing. That's why she's high, and loss of orgasm because loosening. So any role of strengthening devices, Kegel
Exactly.
chair,
Yes.
and that also can help lead to patient to the orgasm.
Kegels is the pelvic exercises, you know.
Strengthening
The
exercise, pelvic
exercises
floor exercise.
are a must
Must
for
for the
any person.
person.
So for the looks, for the build of a person, the personality, tone, everything, in the same way, the pelvic rehabilitation in the form of Kegels exercises or in the form of the availability of devices are there. Kegel Master is available on Amazon. So a Kegel, that device is a very simple device, has to be put inside the vagina and you have to just press.
Open it.
Open and press it. Or a dilator can be put inside and the patient is asked to squeeze over it so that it should be held inside.
Biofeedback.
So
So there are many devices.
these are-
basically that also can lead to treatment of this.
Exactly.
And
So-
what I'm getting is like, obviously you're an excellent sexual health, as you have many devices to treat, but each and everyone can practice, a general gynae can practice, start with a cosmetic gynae. Something, or they should have
this
in
is
this.
another message of mine to every gynecologist, that every gynecologist should be a cosmetic gynecologist.
At least not different, like 1 in 3 female have pelvic floor dysfunction.
Exactly.
And
Yes.
if you ask, but I think sexual problem, we always say is this less. It's less because we are not self-educated. So why will ask? When if I know that I can treat it, then only I'll come. Are you having this problem also? Being a urogynecologist, I ask urinary problem too. But even if an obs patient comes, I ask, do you have any urinary problem?
Exactly, yes,
So even I always ask any patient when comes with urinary problem, I ask the fecal and the sexual problem, because they think this is not bordered or चलता है जैसे ये
चलता है
करता है.
टाइप्स होता ही है मैम, ये तो सबको होता ही है, अब बच्चे हुए हैं 2 तो ये तो होगा
But many
ही.
patients have like hope in their eyes. Okay, this have a treatment. So means when we ask, like, you want which border first, urinary, fecal, or I should focus on this?
Many times if a female is coming with vulvovaginitis and you are making her lie down on the examination table and you are doing her PV examination, and there you find that her episiotomy was not given properly and now she is having a very gaping introitus, and there you ask, just how is your sexual life after the delivery, after this, and she just forgets everything and sits and says,
Yes,
madam, ये
very
ठीक हो सकता है क्या? Things have changed. My husband is saying that things are not as they were earlier and सब बिगड़ गया है तुम्हारा. You should some decent husbands are also there. They are just not complaining. Few are
but
just.
That only I'm saying, when we say patient that you have problem, they very hope in that. अच्छा ये ठीक हो सकता है, ये कुछ है
क्या?
इसका?
Yes, ये भी है क्या आपके पास? This kind of. So every gynecologist, every obstetrician, and we always say that obstetrics is out of sexuality only. The whole world is running because of sexuality of someone like your parents and our ancestors. They all were reproductive function, and sexuality is just not for that procurement, not only for
obviously.
It is for the pleasure also. And we being human beings, we don't know that yes, animals are also having this or not, because they are not conveying, but yes, every living organism is whichever is procuring, is regenerating, is reproducing, is having that sexual pleasure also. So why not? It should be discussed. Why shouldn't we ask our patients regarding this?
If anybody want to learn from you, so how they can learn and detail about this thing, how to, because it's very easy, and as you said, my history taking, but they are point actual when we come to know that this is there, therapy, counseling is there, how to use device, in which patient to wish to use, when what not to use,
how to customize your treatment.
Exactly. So how can we?
Because see, I run my own Indian School of Aesthetic Gynecology, and through which we are giving trainings also. Every 3rd month there is training, and we give the diploma for aesthetic gynecology. Yes, this kind of, you may ask the accreditation. So this kind of accreditation is with no society, in India. No ultrasound courses, no laparoscopic courses, no aesthetic gynae courses. They all have got no recognition from the medical council. But yes, if a trained person is teaching, we give hands-on trainings also. So my next courses are on 23rd and 24th November. So if anybody wants to learn, may
Definitely.
register with us, and yes, I would be there to
Thank you, ma'am.
treat.
Thank you so much for the valuable time.
Okay.
Thank you.